So, starting from the top, this is the frontal, and this is what they're known as the coronal suture. As you can see, probably see the little dividing line right here, and then on the sides is the parietal, and then
squamous on the side.
This would be the squamous suture, dividing the temporal and the sphenoid from the parietal. Over here in the back is the occipital, which is divided by the lambdoid suture. And then the sagittal suture basically divides left and right. Okay? And then starting here, there's 7 cervical. And C1 has a name just like C2, and that's known as atlas. C1 is atlas, C2 is axis. And then there's 5 more. So that's the C7 of the cervical. Then the thoracic is 12. It's 12 vertebrae. And then down here is known as the sacrum, which is 5. And then below that is coccyx, which is 4 fused together. And then, as you know, these are the pelvic bones here. And then we have
the ribs.
So up here. Well, actually, let me finish right here. So basically, these are the eye sockets. You know, the orbital, vomer right here. This is the nasal. The upper jaw is the maxilla. The lower jaw is known as the mandible. These are little holes are called the mental foramen. And then, as you see, the teeth and everything. Then this is the middle nasal concha, superior nasal concha. Over here, this is known as the zygomatic arch. And then the sphenoid would be on the side right here. The 2 little parts right in here is known as the lacrimal, and then just behind that would be known as the ethmoid. And then right here, this is the clavicle, scapular right here in the back, sternum, xiphoid process, and then the ribs. With the ribs, there's 12 ribs. There's 7 true ribs. 5 false and 2 floating ribs, and then right here.
Those are the floating ribs, right?
Yeah, and then right here, this is the humerus, and then it would be the radius on the outer. Yeah, right there. So it'd be the radius. So basically, like if you're in an anatomical position, as they say, with your palms facing out, the bone that's going to be furthest away from your body is going to be the radius, and the one that's closer, known as medial, towards the midline of your body, would be the ulna. And
that's actually the elbow, right? When we bend it.
Yeah, that would be the elbow right there, known as the olecranon, you know, in technical term. And then, so the carpal, as everybody knows the term carpal tunnel, that would be right here, basically your wrist. And then metacarpals would be the first portion of your fingers, the medial portion of your fingers. And then the fingers would be known as the phalanges. So the furthest away is distal. The medial or middle, you know, after that would be medial. And then the ones closest to the point of attachment or closer to the body would be known as proximal. And then this part right here for the pelvic bones, this is known as the ilium right here. This would be known as the pubic bone. The pubic symphysis basically joins these 2 together. And then in the back here, or this hole is basically your butt bone is what it's known as, is known as your ischium.
And so we see them our ischium.
Right. And so down here we have the femur, which is known, very important to remember, this is known as the biggest, largest bone in the body. Right here, from your hips down to your knee. And here's the kneecap, the patellar, and then down below you have the fibula, which is always known as the more lateral bone out of the 2 in your lower leg. The medial one is known as the tibia. And then if you move down to where your foot is right here, this is the tarsals, basically kind of like how you have your carpal for your hand. This is like basically would be like your wrist for your feet, for your foot. So this is the tarsal, the metatarsal, and then over here would be the phalanges, kind of like your fingers. And as mentioned before, it would be distal, furthest away, medial, closer, or midway, and then proximal would be closer to the point of attachment. And then the back sole of your foot right here is known as, it's the heel known as calcaneal. And then, the sole of your foot would be the plantar.
This part over here?
Yeah, basically the sole of your foot.
And she said something about the true...
the true pelvis. What was the true pelvis?
The true pelvis and the false pelvis.
True
I
pelvis,
think she says the false pelvis was on top.
The
right?
fake pelvis, the false pelvis is all of this on the outer part, and the true pelvis is inside. Everything inside here.
Should we show a male pelvis and a female pelvis? I think she has two over here.
So
that's the female, right?
This is the female. You can tell right here because see how it's more wider like that, and it's less arched like a triangle, or a pyramid. It's more wider and more spread out in these areas right here. As you can tell, that's the male.
Yeah, it looks more like...
So you can definitely tell the difference right there between those two. Male would be on the right, the female would be on the left.
Yeah, they look completely different. And I think we have everything.
Cool.